Thank you for staying with us. There are several unfortunate cases of gunshot victims in Nigeria who have lost their lives due to lack of immediate medical attention. In addressing this issue, the Acting Inspector General of Police, Olukayode Igbetukun, had instructed medical personnel in the country to administer treatment to gunshot victims without asking for a report. In reaction to this, the Nigerian Medical Association sees this as a welcome development, saying that they would adhere to the directive of the Acting Inspector General of Police to ensure the safety of lives. Well, joining us in the studio is public health consultant Tui Mebaodu. Good morning.
Good morning.
Thank you for joining us.
Good morning. Good morning, Brian.
Now, in 2017, a bill was passed that the former president, Muhammadu Buhari, signed into law with regards to this matter of addressing gunshot wounds. But between then and now, we have seen a number of victims pass as a result of, hospitals not administering the needed treatment to these persons. And we have, even in the past, also seen a former Inspector General of Police also go ahead to talk about this matter, that hospitals should administer. But what is different now that one should expect, because we have a law backing the treatment where there is a fine of 100,000 naira if you do not? We have not seen much with regards to that. I'm wondering if there's anything different that will happen this time around.
I hope something different will happen. Nigeria is a peculiar situation, requires peculiar legislation, because normally the care of gunshot victims should have fallen under the general emergency care of any health system, not necessarily trying to craft a separate law for gunshot victims. Right. But okay, here we are now. We have to find out why we're doing this. Gunshot is actually a medical emergency, and every minute, every second counts. Because the kind of rifle or small weapon that is used in the attack, any place around the human body that the gun touches is an emergency, because if there's ingress where the gun comes out, you don't know the extent of damages that might have happened. Right. And then if you look at our peculiar environment, cultism, banditry, kidnapping, social strife, separatists, all sorts of characters, where we have as much as 6.2 million guns in the hands of civilians, whereas we have 500,000 in the hands of the security people. So by this, you are looking at, out of 11 guns circulating in Nigeria, 10 are in the hand of civilians, 1 in the hand of security agents. So that's quite concerning. And when you look at that kind of environment, you know that definitely you will see a lot of gunshot injury, happening. And then if you try to track it, local versus urban, you see that most of the time this thing is as if it's not even an urban issue now. It has gone into local environment because of the banditry and kidnapping. Of course, in that case, you need to codify a kind of treatment, and that is why, the Comprehensive Treatment and Care for Victims of Gunshot Injury Act was enacted in 2017, rightly so. When it has what we call 2 rights and also 2 obligations. Right, first of all, to the victim, and right to the helper or sympathizer. That the victim has all the right to be treated without paying a deposit, and then must be handled with care. Okay, and then that even if you are supporting, trying to help the victim, you must not be actually harangued or attacked or even molested by the police or anybody at all. That is at the level of victims and the helper. But at the level of the hospital are supposed to first of all quickly take the person in without asking for police report. But you have to report that case to police within 2 hours, and then there's a problem there. I will discuss briefly about the problem. Now, how many police stations do we have in Nigeria? Is it the same thing in a local Savara village or remote part of Rivers State? Are you going to get to a police station? Is there a dedicated line that I can report to? Is there a video? Is that a way to communicate in a way? That becomes the problem for a doctor who might find a way to refer the person and just give one little suggestion and refer that, at least I've done one thing, I'll refer you to the next place because I can't handle you. Secondly, there's a punitive thing that if you refuse to accept and treat, there's 100K or 6 months in prison. I don't know why we tend to push for punishment every time. But should the patient sustain sufficient injury that lead to loss of life or disability, 5 years in prison, 5 to 15 years in prison, without any option of fine. Even the people that are stealing Nigeria's money are not having those kind of draconian law. So, that kind of thing is going to cause a lot of reticence on the part of the health worker and the hospital in treating patients, because these laws are very, very harsh. Now, you ask a fundamental question. When you said I should not take deposits and I'm brought in my hospital, it's a gunshot injury, I want to save life. Who pays for me if at the end of the day? The law is not covering that. Government is not speaking to that. If they had a dedicated money with the police or with whoever that says that if you incur any loss from this, right to this place, we'll check through the process and you'll be paid. I think that will sort of encourage the doctors. You just put all this thing on the doctor. That's why this thing may not work. We may have to come back next year and still talking about people not attending to gunshot victims. Now, also they've told the doctors that don't release these clients to any police for further investigation until you are sure that the person is okay. There's another problem. Police will come to you, harangue you, talk to you, we want to take this person away. And then you are constrained because who is protecting you? In reality, there's nobody protecting you. So I've not even seen that kind of civil service movement, civil society movement that will try to protect doctors in that regard. And then the police, you are told that, okay, if you try to harass somebody, you can get some years imprisonment or fine, as the case may be. So there's a lot of gaps in that. Good enough, we're not pushing for advocacy. We're not reconfiguring the training of police, the training of doctors to accommodate this kind of thing. And then those gaps will keep happening. People will get injured, and then doctor will find a way around it to let the person go. Either saying that I'm doing a referral, I cannot take care of this patient. So it's not just about us putting the law, telling police, and the NMA accepting. There are other stakeholders in the health system. There are other things we need to do to strengthen this law and make sure we don't have death from gunshots.
Well, this thing that we need to do is the reason why we're having it, because we all understand the reason why this problem is going on, which you've spoken to. A situation happened in Lagos State, a few years back, of a very notable man who was robbed, shot, and then taken to the hospital. But due to getting police reports, the person passed. Another person was also robbed and shot in the shoulder. But because the doctor didn't want to respond to, didn't want to attend to the person's emergency situation, the person has got connection with police, the police force, and the brother came, a policeman, harangued the doctors on duty, and he said he was going to kill every doctor on duty if his brother died. So, and that was why the person's life was saved. So, in all of those cases, what are the areas you feel that we need to really look at so that we can fully implement this law?
Any gap, there's this gap. Police is giving some clear instruction. Please treat all gunshot injury. Now, we need to really take those communication down, okay? We cannot just say it, and it hangs, a lot of things hanging around in the nation, many information. Now, are we actually saying, as part of police communication every week, that please help us treat gunshot injury? Are we seeing on our big board that now gunshot victims can now get treated without having a police report? We have to communicate that consistently so that even the victims and the relatives of the victims can assert their authority whenever they get to an hospital and say, listen, we can be treated. We can be treated without the police report. And then this idea of their 2 hours framework, for me, is too short. You might be battling with a gunshot victim for hours and not even have... So if you now break the 2 hours, so what happens? Okay? And Nigeria, we're strained in a way. Any little things, we want to use it for quarrel and drive social media in a way. So everybody is trying to be extreme. In fact, if you look at the stream of negativity that the health profession is facing in recent times, everybody is trying to be careful. You don't want to be on the social media for the wrong reason while you're trying to help. So we need to do that communication. We need to actually provide that funding. If I treat somebody that the cost is running to some tens of 20s of thousands or hundreds of thousands, and you say that I must not collect money, which I have agreed, really, who pays for the money? We have to actually tidy that aspect. Then the curriculum, in terms of discussing, of course, doctors, even during housemanship, during their final year training, in their trauma training, we now have to incorporate this thing into our psyche that, guys, whenever you see anybody, gunshot injury, just go ahead and treat. Put a call through to this person or that person that I have this situation on my hand. And then let us also be very careful, because now you're saying that a patient cannot leave hospital until he's fit enough. You cannot interrogate the patient until he's fit enough. And let's look at the Nigeria peculiar situation. You can rest assured there's no security for hospitals. People come there and attack them.
Even prisons where they are.
There's no security. I can tell you that let's say it's the case of hoodlums, armed robbers, or that kind of.
But it's a security risk.
They will just enter the hospital, do anything and carry their person away. So and then that aspect is also very important, that you have to protect the hospital. You have to secure the hospital against such invasion. So there are a lot of fears running around. But again, it's not just talking. We have to actually engage the stakeholder, deepen the conversation, improve the training at level of the doctors, improve the training at level of the police and how to handle them, and actually put it on our face in terms of our billboards, our social media. Put those things there and tell them clearly, guys, you can treat these people so far now.
We need to quickly go on a commercial break. When we return, we'll continue this conversation. Stay with us. Before we went on the break, we're looking at the matter where the Acting Inspector General of Police, Olukayode Egbetokun, has instructed medical personnel in the country to administer treatment to gunshot victims without asking for a report. And we still have in the studio public health consultant Tuyime Bawadu speaking with us on this issue. And we're talking about how we can deepen, this conversation. But for people to better understand what you're talking about, let's perhaps have some experiences that perhaps you have had with regards to treating victims of any kind, of any sort, and perhaps a way of getting around it.
You see, when you practice a profession for more than 3 decades, consistently, you see all sorts, especially when you have an experience of public practice and, of course, individual or private practice. In my 21 years working with Lagos State government, we had series of experiences. People that felt that, why should my child die? Despite the fact that they brought the child very late. And they just moved their family into the hospital territory, public hospital territory. They move their family, they come, they beat up the doctors, tore their clothes, and all sorts of things happen. What are you going to do? So by the time you I'm giving that. By the time you even get to in a city center, by the time you get to the police, come back, they're gone, because you can't really apprehend them. So that aspect is there, and you've seen situations whereby, maybe by my world then, when I was still doing some private practice, where somebody comes, just lean on your word like this and just collapse. You have to carry the body. I've not seen the body. You have to carry the body, settle police, do this, do that, before you can get out of it. When you have a situation whereby some women came to the hospital, did antenatal briefly, ran away and abandoned the baby for whatever reason, not because of fun, for whatever reason, you still have to carry the baby to the police, sort out a lot of things. I'm talking about from experience. And then, in reality, police are very reticent, they're very reluctant to intervene between those issues between doctors and patients. They just don't know, because, again, for a lot of perception, because, what you observe in this nation now is that there's an epidemic of mental health, really huge epidemic of mental health ongoing, which we're not addressing. A typical example is a situation whereby you see people under 40 consistently killing their girlfriend, getting involved in ritual killing, doing all sorts of things. And these are people with a lot of energy that can work, that have a lot of future ahead of them. And they are killing people to want to get money. And we're not addressing it. Somebody is not feeling uncomfortable that this is an epidemic. We must understand why somebody would think that cutting breast and private part of anybody will turn to money. And the thing becomes, so rampant among younger, able generation. And then you cannot imagine, with the epidemic of even the drug abuse, and you now have one of those cult guys or gangs, when they're fighting, get shot, you put them in an hospital, and then you're still trying to get to police, the person gets well a bit, they will storm the place and take the person away. Is police providing cover and security for such center? That is the question.
It's a whole lot of...
yes, and then police will tell you that they are busy. They have a lot of things ahead of them. So it is proper for the doctor to actually measure and gauge within all these things. But what could have happened easily is for police to provide a clear-cut line where you can put report either as WhatsApp or a call or whatever, or video this thing, and upload that. Listen, I have so in my place, so I don't want to mix the 2 hours deadline you have put there. And I keep repeating, if you don't talk about how to pay the doctors the money, you say treat without deposit. If you don't talk about how to pay the money, who pays now?
Well, we think
is there an insurance for that?
We think it's part of the practice that for doctors.
For doctors.
Doctors save lives, and that's your priority. That's the first thing that was taught in
Hippocratic oath.
Exactly.
Indeed.
Which you have sworn.
Indeed. Like politicians sworn to uphold the Constitution. Like politicians sworn to uphold the Constitution.
No, why should money come first?
And now, after I have treated, money didn't come first. No, Ibrahim, calm down. Money didn't come first. After I have treated this person, the person is well now. Where is my money going to come from?
No, but some ask
service
for
to humanity
before they even touch.
No, it's okay. Now we have a rule that says don't ask for deposit, and we're following. And then I didn't ask for deposit. I treated this person, so get well, and the money is like 200 and something thousand. I said, pay me. Where's the money going to come from? The person walked away. So how does that encourage me? You need to be on that kind of field and know what it means to take a little bit like 30,000 from a whole family. You need to have that experience. I'm talking from that lengthy experience. Of course, there are few Nigerians that can even pay if you want to go abroad. But I can tell you, 90% don't have. And then the challenge is
that perhaps this is where the private sector needs to also...
You'll be shocked that even the insurance scheme is not covering gunshots. Nobody is covering gunshot injury.
Why?
You can ask the national insurance people now. You see, nobody is covering that. Even really procedure that's not going, they're not covering.
Yes.
So you are left to your own, and then you are seeing the increasing court activities for instance, in Lagos, all around Niger Delta, in the northern part of Nigeria, banditry, and they shot themselves, and then they come to the hospital in drop. And then when they come, they don't come alone. They come as movement. They are there, you are still you're attending to the person.
So invariably, we need to begin to rework our health insurance scheme.
Indeed.
All of it.
You see, police cannot just, it's nice. I love NMA. They say, okay, we're ready to follow with you. It's not going to be that easy. Let us look at, that's why when you are crafting a law, you should engage people that will look at the likely scenario that can actually make the law not to work. Or else it will just be the law. Because a doctor will have a way of covering himself. You just write a referral letter. I said that, give you little pain relief. I said, listen, I can't take charge of this. I'll take your letter and go somewhere. And this guy is covered.
You keep referring up.
Yes.
Matter of factly, when a law is disregarded, this can affect everyone, including the one who failed to carry out the law or the one who failed to also, implement the law. A report has it that a police officer with the Songwater Divisional Police Station also suffered the same fate after he was attacked by robbers, in his own house. He was taken to the hospital, but he died. He was not able to be treated as a result of the same law that disregarded. Do you consider this as a motivating factor for the police force? The IG Egbetokun now ensuring that this is
it's quite challenging. It's quite depressing to see people that can actually not die. There's a lot of needless death happening in the nation. First of all, I will canvass an interface between the police, Nigerian Medical Association, and various stakeholders, like Association of Private General Medical Practitioners in Nigeria, for instance. You have to create that interface of discussion, of sharing experiences, and looking at what can happen. After the law now, create that interface. Create an interface for reportage, even without going to the police station, okay? Then sometimes you not even get to see the family, because part of the law says that you must inform the family within 24 hours. You will not then be able to see the family. The person may be so unconscious and may not be able to talk for a number of days. In that situation, what should I do? Because in reality, I'm violating the law. So that kind of dialogue will smooth those rough edges. And then you look at it that, okay, if you do this treatment and you've incurred this amount of money, how do you get your money paid? The police, that dialogue will help. So the dialogue between the police, the stakeholder in the medical profession, and even the government will help us smoothen this. And then what is also very important is that there are substrates that this thing is standing on. The platform, all this law is standing on. First and foremost, a proper health emergency services. Yeah. The ambulance have disappeared on the roads of Lagos, for instance. So I don't know of Zamfara State or whether the ambulance is there, but in Lagos there are no. Ambulance have disappeared. We're not seeing those emergencies. Secondly, the law against small weapons, we need to firm it up. Okay, America is the leading one now in terms of killing themselves with guns. We don't want Nigeria to get to the state of America.
Even though a governor
Some governors are proposing that people should defend themselves, our own
that
arms.
We should be licensed to carry guns.
You should cite an example of a country that is so safe carrying guns. Then I'll hands off. We know what Finland is, we know what Sweden is, we know what UK is, why UK had to ban those things.
But what's your solution, quickly, because of time, to the matter of financing? How should it be covered?
Now, I think there must be a critical fund, maybe at the level of, I won't say, at level of the state, whereby if you get to treat such a person, with the police, you file all your reports and send your bill across to the state. The state, in the process, the state will also try to locate the family and see what they can pay out of it. And then the state will be as a form of insurance against your loss. Because if there's no insurance against your loss, I am telling you, I don't know where private hospital is profitable. Though. I don't, not in this nation. Because you have to do lights, you have to do equipment, you have to bring in those experts. And then you have to pay on the loans you have taken. So at any point in time, the doctor will be looking at it that, how do I recover my money? If the state can say, listen, we've kept this amount of money to cater for those kind of injury, file your documents, you can get paid. I think that will also help. So that dialogue, police, secondary medical profession, and the state will help us to move forward substantially.
That's quite an interesting conversation. But then, do you see, before now, this have been, going on and on and on. Do you see the role of the social media? Because now we've begun to be talking about it, the social media, about people that have been shot and killed. Do you see the role of the social media in this? How would you
I will reiterate it again. Medical practitioners, medicine has changed. I think we should be able to have seminars. We should start having seminars on how social media affects deliveries, perception of healthcare in any country. And doctors, nurses, lab scientists, pharmacists, we need to embrace social media to drive the right narratives, or else you'll be hit in a different way. It's a psychological war, which if you choose to neglect, you can't win. You won't be happy about that.
As victims of gunshot wounds, is there something they can do? Well, some persons may find themselves unconscious and all, but is there something?
Yes, the helper. We mentioned the issue of the helper. People try to run away because police can say, hey, come and write, come and explain. Helper, please, guys. When you see anybody in any emergency, including gunshot, try to help. You are also part of the group saving life. First, if there's a bleeding, just tie cloth. Because invariably, bleeding is one of the commonest causes of death in those kind of injury.
Right.
You know, bandage the place with any cloth, just use it to, and then immediately seek help, call emergency, call ambulance if it's
Is it
still
bandage the wound itself or bandage the place before the wound?
No, the wound on top of it. Just tie cloth on
As
top.
tight as possible.
Yeah, as tight as on top of that injury. You know, let the person. You know, don't carry the person ambulatory. Lie the person, you know, down, and then carry the person. Call an ambulance. Call the police. Seek an hospital that is nearby. Do all you can. You are protected. The law protects you. Why not?